Hello. Now I'm going to talk about Module 1, Introduction and to the Advanced Practice Nurse. And in this module, we really are looking at what it means to be an advanced practice nurse. And so we really look at the development, and when you're looking at assessment item 1, this is where it actually needs to be looked at in your own clinical area. We're also looking at the domains of practice for the advanced practice nurse and how these align with clinical practice. And so remembering that as a registered nurse, we work in domains of our practice, but then as an advanced practice nurse, these then are extended to be clinical, education, research and leadership. We also will look at the scope of practice and the roles. And this is really important to think about as you're looking at your own clinical area of what models of care are you working under? What theories underline your practice? You know, are you working to a particular model of care within your hospital or within your clinical area? And how does that influence your actual clinical practice? And we're also going to look at the implementation of the advanced practice nurse and how to actually measure this change. And so when you're looking at this research that's in relation to these modules, please remember to sort of think about this as you're doing your assessment items. And so the learning outcomes for this particular module are examine historical development of advanced practice in nursing in relation to your own healthcare setting, critique and apply these characteristics, integrate this knowledge with legal, social and ethical factors that influence the development of the advanced practice roles. And so this may be if you're looking at pain management, is it equitable across all patients? And, you know, is there an actual aspect of social inequities in your particular clinical area that could be addressed by an advanced practice nurse? Then really learning how to actually articulate that role and how to look at then sort of innovation and outcomes. When you're completing this module, really make sure you organise your time. Think about how you are linking what you're reading over the topic with the assessment item 1, and it should take about 50 hours. So this is about 4 topics, so about 10 hours each. Watching the videos, looking at the articles, remembering to look and open your reading list for the course because it has the current research. And this will be really useful for your assessment item 1. So make sure as you're reading and completing the module that you're looking at the assessment item 1 to build that information. Remembering this is actually about your clinical area. So think about sort of what is your type of patients, their patient acuity, and really think about how this advanced practice role is related to improving the practice in your clinical area. Remembering that you're working by yourself, and so sort of understanding what is your scope of practice in this advanced practice role, and linking the theory and the models of care to this role, and how to implement this within your own clinical area.